It started with me noticing that when I would wash dishes and put them in the dish tray, there would be a tremor in my wrist. It was scary. I mean, my image and the stereotype of people with Parkinson's was someone who, had much difficulty walking, who lost control of his limbs. There's no cure for it. So the diagnosis felt devastating. But I sort of told myself, I just want to stay alive and live my life as fully as I can. One of the primary interventions for Parkinson's is boxing. And there's actually a Parkinson's brand of boxing. So it encompasses the major dimensions that people involved in physical therapy think are important to maintaining yourself. Things like hand-eye coordination, strength building, and balance. But one of the great hidden secrets about boxing is that we're there 2 or 3 times a week with the same people, and so friendship networks develop. So one of the people in my class said they were doing this research project with BU and gave me a number to call, so I called up and I met Dr. Ellis.
Parkinson's is fascinating because the big picture problem is really this lack of automaticity. People with Parkinson's disease, they can walk, but they can't do it without thinking. You and I don't think about walking, we just walk around, and we do other things with our mind, right, with our attention. People with Parkinson's have to think about every step they're taking in order for those steps to be effective. That is a fascinating problem, as a researcher to try to think about. So we do a lot of different studies trying to improve automaticity. One of them is using music.
So Ed, before we start the walking, what we'll do is we'll put the sensors on you, because in this project, we're definitely getting the speed of your walking, how far you walk, but from some of these sensors, we can start to understand the quality of your walking and some of the biomechanics of how you're moving. Ready? Begin.
Okay.
One of the telltale signs of a Parkinson's gait is a small step length, kind of shuffling steps. There's a slowness of walking, and the intensity of walking is less. And so we use music in a way that is specific to helping the step pattern or the cadence.
It was structured in such a way, they're very sneaky, because after the first couple of minutes of walking at a particular comfortable pace, they would play a song that would be much faster. So you would continually sort of ratchet up your speed based on the music.
The sensor actually measures the step pattern, and that gets fed back into an algorithm that takes the music and it expands or compresses the music so that the beat of the music matches the beat of the walking or the cadence. So we've been able to show that we can increase the step length. So then there's a sort of a more normalized gait pattern with less shuffling. And we found that the number of minutes in which they walked at a moderate intensity increased significantly. So we improved the quality, intensity, and amount of walking.
I relish the importance of doing research, but research that's very practically oriented toward helping people do things. As long as you can continue to walk, you can continue to be independent and take care of yourself. So I think that's a very important, healthy emphasis.
We were almost finished with the balance assessment last time, but there was one section we didn't get to. So I'm wondering if we could start with that,
Sure.
if that's okay. All right, begin walking.
For me, one of the important keys is acceptance coupled with fighting to stay as healthy as I can be. I don't have to sort of push away my feelings around this. I can accept the fear, the anger, as well as the anxiety around it getting worse. Because as long as I continue to work hard, exercise, do what I need to do, I have a sense of hope